Sometimes a biopsy report says DCIS, ductal carcinoma in situ. Other times it says invasive breast cancer. Now many women immediately ask, "Doctor, what's the difference? Is DCIS really cancer? Do I need the same treatment as invasive cancer?" Now these terms can be confusing, but the difference is important because it changes both treatment and long-term outcomes. In this video, I'll break down exactly what DCIS means, how it differs from invasive breast cancer, and why catching it early makes all the difference. Hello, I'm Dr. Niharika, breast Onco-Surgeon at SSO Cancer Centre. On this channel, I aim to simplify breast cancer information so patients and families feel informed, supported, and empowered. Today, we'll cover what DCIS actually is and why it's called stage 0, how invasive breast cancer differs in behavior and risk, why DCIS is treated seriously even though it hasn't spread, how treatment plans differ between DCIS and invasive cancer, and finally, the outlook and survivorship in both situations. By the end, you'll see why early detection matters and why understanding your pathology report helps you feel in control. DCIS, or ductal carcinoma in situ, means abnormal cancer-like cells are found inside the milk ducts, but they are still trapped within the duct walls. The key word here is in situ, which means in its place. The cells have not yet invaded the surrounding breast tissue. That's why we call it stage 0 breast cancer. It hasn't spread, but it has the potential to become invasive if left untreated. Now, survival rates for DCIS are excellent, with cure rates well above 95% when treated appropriately. Now, in invasive breast cancer, those abnormal cells break out of the ducts or the lobules and spread into the surrounding breast tissue. Once the cancer becomes invasive, it can enter nearby lymphatic channels, spread to lymph nodes under the arm, and potentially travel to distant organs. The ability to spread is what makes invasive breast cancer more dangerous. Now, invasive cancers are staged from stage 1 through stage 4, depending on tumor size, lymph node involvement, and whether metastasis has occurred. While cure is still very possible in early invasive cancers, the risk of recurrence and the need for a more aggressive treatment is higher compared to DCIS. DCIS is not life-threatening by itself, but if ignored, in a certain percentage of women, it will progress to invasive cancer over time. That's why we take it seriously. The distinction is crucial because DCIS is confined, curable, and treated to prevent future invasion. Invasive cancer has already gained the ability to spread and therefore requires broader systemic treatment beyond just surgery. For DCIS, surgery is the main treatment. Now, this may be a wide excision, that is a breast conserving surgery with oncoplasty if it's limited, or a mastectomy if it's widespread across the breast. In DCIS also, sometimes in limited cases, lymph node sampling is required. Radiation is often added after wide excision to reduce the risk of recurrence. If the DCIS is hormone receptor positive, hormone therapy like tamoxifen may also be used for it. For DCIS, chemotherapy and targeted therapy are usually not required. For invasive breast cancer, surgery is combined with other treatments based on stage and biology. This may include chemotherapy, targeted drugs like trastuzumab for HER2-positive cancers, hormone therapy, or immunotherapy. Lymph node surgery is also more commonly required in invasive cancers to check for spread. Now, the big difference is that DCIS is usually treated locally, while invasive cancer often requires both local control and systemic treatments. One fear I often hear is, if it's just DCIS, can I ignore it? The answer is no. Because while not every DCIS will turn invasive, we can't predict which one will. Treating DCIS prevents that risk. Another misconception: DCIS isn't real cancer. While it's very early and highly curable, DCIS is considered a form of breast cancer. That's why it appears on the reports as carcinoma in situ. The good news is the outcomes are excellent when DCIS is treated promptly. Now, after DCIS or invasive cancer treatment, follow-up is very important. Regular imaging like mammograms or sometimes MRIs if indicated to check for recurrence. Physical exams by your surgeon or oncologist, especially in the first few years. And lifestyle care, maintaining a healthy weight, balanced diet, regular exercise, and avoiding smoking or excess alcohol all reduce recurrence risk. Even after cure, survivorship is about staying vigilant and focusing on long-term wellness. DCIS is often found in screening mammograms before it causes symptoms. That's the power of early detection. It gives the women the chance to be cured with simpler treatment before the cancer even becomes invasive. Invasive cancers, when caught early, are also very treatable. But once cancer spreads, treatment becomes more complex. That is why mammograms, awareness of breast changes, and regular checkups are so vital. So as to summarize, DCIS means abnormal cells are still trapped inside the ducts, stage 0. Invasive breast cancer means the cells have broken out, stage 1 or beyond. DCIS is highly curable. Invasive cancer is also treatable, but the risk and the treatment intensity are higher. The key lesson is this: the earlier we catch it, the simpler the treatment and the better the outcome. If this video helped you understand the difference between DCIS and invasive breast cancer, please share it to spread awareness. Don't forget to like, subscribe and click the bell icon for more patient-focused education.